My name is Dr. Chris Barasa. I am a gynecologist and a governance specialist. But currently I am serving as the General Secretary and CEO at the Christian Health Association of Kenya. CHAK is a Protestant church faith-based organization that's actually clogging 80 years this year since its formation. And the aim of forming CHAK was basically to coordinate the functions of the member health units in as far as actualizing universal health coverage. Our vision is to provide quality health care to all for the glory of God. We've been preparing ourselves as CHAK more or less towards this sustainability journey. And there are some very specific and deliberate interventions that we've been putting in place. Because we look at transitions, we look at sustainability models, we look at the desire to transition services to governments, not as a disruption of services per se, but as a way of testing the interventions that we've been putting in place. How mature are they? Can they be deployed? And there are some models that we've actually put in place. One is what we call the CMaT model. CMaT previously stood for County Mentorship and Transition Model. But as we moved on with time, we noted that it was actually beyond counties. We noted that other governments in Africa and other developing countries would wish to adopt the model, but they don't have counties, they have districts, they have other administrative functions. So we just call it CMaT. And what that model does is basically to assess the institutional readiness towards transitioning of HIV services. The second model that is very, again, dear to us is what we are calling the IMARA Care model, integrated model for accessible, resilient, and accountable care. And the IMARA model is an implementation model that has been piloted in 3 counties of Kiambu, Kitui, and Nairobi in Kenya. And this is a model under an implementation science study that CHAK, in partnership with the University of Nairobi, are undertaking. The research aims at evaluating the readiness for the country or the 3 counties to undertake an integrated model using the frameworks that we've developed. Our role is basically to provide thought leadership and technical support using some of the models that we've been able to implement, but at the same time provide advocacy so that the population that we serve continues getting the services that they have. So the time to actualize these interventions is actually now as a country, because as I mentioned earlier, it was a matter of when and not whether transition of services would happen. So if there's a model that has proven to be cost effective and cost efficient, such as the CMaT model and the IMARA model of care, then the time for scaling these models is actually now.